Welcome everyone. I'm glad you guys made it this evening to our Regenerative Health seminar. We're going to talk about a lot of great things today. Most importantly is more ways to actually start reversing the aging process, helping your body heal itself, rebuild damaged tissues, and show you some ways to really help get better quality of life in certain areas that you may still be struggling with. And we've partnered with True Health, who really has taken the stem cell area and made it more available to more people in the community. Like before, you had to go to special facilities, you had to travel to other countries, it was difficult to do. Now it's becoming more accessible to those people because it's been tested and used more, we're seeing results with it, that you and I can access this as a healthful, more natural type of therapy. And we have Tammy here, who's part of our team. She is a medical professional that comes in and administers the stem cells and does a lot of the medical type work along with that to make sure it's safe and effective and that everybody has the follow through that they need. And we also have support through True Health themselves. One of the medical professionals, Cheryl, is going to join us a little later today to answer any questions or anything you guys may have about how this therapy works. And really the purpose of today is to help you understand this as a possible thing for you or maybe someone that you know and really understand how the process works, because a lot of people maybe they've heard of stem cell before or different kind of regenerative therapies but don't really understand how it works, what the process looks like and everything else, and our goal is to help clear that up for you today so that way you understand if this is something that's going to work for you, someone else, or just understanding more about how this works, it's going to be a benefit. Does that sound good?
Yes.
And everyone should have had this questionnaire here, not questionnaire, but kind of goes through some stuff about how it works, something to take home with you. And for those of you today that feel like this is something you do want to move forward with, the next thing we do is we'd schedule an individual evaluation where we can evaluate you and any potential joints or areas of concern to see if this would be a good fit and then what the process would look like. Sound fair enough? All right. So the biggest thing we want to get into is, what if it was possible to go back to like it was when you were a baby or a small child? You remember you could fall and hurt yourself and whatever, and like poof, it was just gone like that, right? Because your body, when you're young, has a very high stem cell count. Stem cells are basically undifferentiated cells that build joints, tissues, and pretty much all other parts of your body. So when you're young, you have all kinds of stem cells. Your count is really high. As we age and get older, that counts go lower and lower and lower. And that's why the effects of aging become more and more apparent. It's harder for your body to recover, you degenerate faster, especially if you've had old injuries and issues. Joints and other parts of your body continue to degenerate and break down over time, and typically they're not going to rebuild themselves without significant levels of help. So most people end up just dealing with pain or issues, getting other types of injections like steroid or epidurals that many times don't work and at best are temporary, and a lot of times even leading to surgery or just dealing with chronic pain. We don't want that. How nice would it be to actually have your body heal itself again by reinvigorating regeneration, where joints and tissues could even start rebuilding themselves and repair year, sometimes decade-old damage. So really how it works is we want to find a way to restore and rebuild damaged tissue over time. And that's really what stem cell does, is it stimulates natural healing from within your body by adding in these stem cells to different parts. And the cool part about how stem cells work is that it can reproduce and change cells of a similar type, so like a muscle or a bone or some type of connective tissue. And it can even help with other types of tissues, things with immune system benefits, slowing down of the aging process, can help reduce inflammation, can help reduce scarring. There's a lot of other benefits that come along with it as well. So at the most basic idea of how a stem cell works, just think of it as like a blank slate, right? So a blank slate that can go in and help repopulate and regenerate tissue around that area. So what it can do is it can go in and actually help differentiate into different types of tissue. So like we talked about, cartilage, so connective tissue is what moves and supports the joints in your body. This would be like tendons and ligaments. You can also rebuild muscle. So obviously we all understand how muscle works and how it moves. Many times when muscle gets damaged, it gets scar tissue and fibrosis and all this other stuff in there that doesn't fully heal. Part of what the stem cells can do and some of the other things that's in there is reduce inflammation and break up some of that scarring so we can get some regeneration of healthier tissue. And when you have healthier tissue, not only is it in less pain, but it's more flexible, it's more mobile. It can take more where you can actually push it and you're not in as much pain. It doesn't get injured as easily, and we're going to recover a lot faster. And it can also help with what's called apoptosis, which is cell death. So part of aging is because your cells, they die and they replicate too fast. By coming in and bringing in some regenerative cells, it actually helps slow down that aging process and restores more of regeneration. So these stem cells are like master cells that actually seek out these areas of degeneration and decay to know where to go in and start rebuilding. And also things in there called cytokines, which actually stimulate the healing response. So it actually goes in and looks for these areas that aren't working well and starts to build it back up. It's pretty cool. So it's actually signaling your body to promote the healing response. That's just part of the things that we do in here that really helps. Now, there's other ways that we've been doing this for different types of years. People have done blood transfusions. If you ever looked at bone marrow or how this works, that's pretty much what they're doing with bone marrow, is we're taking these types of cells, which is where a lot of your stem cell will exist, and they're taking it either out of you and typically donating to somebody else. They would do this for maybe cancer patients or patients who have major health concerns. I don't know if you've ever done this before, but for those people I know have done it, it's pretty darn painful. They go in with the giant needle and inject it out of your hip or other parts of your body, and not super fun, very invasive. It's, you know, an outpatient procedure, but there's a lot of stuff that go with it. There's rehab, there's lots of downtime. It can be very expensive, and so there's a lot of things that go along with this, but it's not even the most effective way to be able to do this. This is really old technology that they have been using, and now we can use stem cells that are a little bit different. This helps you understand how it works. So when you're a newborn or a small baby, 1 in 10,000 cells will be called a mesenchymal stem cell. So basically, these are the stem cells for building, regenerating tissue, because when you're a small child, a baby, you need to build tissue all the time, right? So the need to rebuild is very, very high when you're that young. Now, as you get older, as you see already in a teenager, you've already lost this 10 times. So now it's 1 in 10,000. So your body is not growing as much, it's not changing as much. The need for these stem cells and regeneration isn't as high. As you get into your 30s, that's 1 in 250,000. By the time you're 50, that's 1 in 400,000. And by the time you're 80, that's 1 in 2 million. So basically, you have none, right? So that's why as you get older, stuff feels slower, right? Things don't feel as well. It seems like it takes longer to recover. That's what really stimulates the aging response of things like skin and hair and nails and other parts of your body, because you don't have these stem cells anymore. Your collagen production, your tissue repair, all these systems really start to slow down as time goes on. So it makes sense as you get older, the need for these types of things becomes higher to help your body adapt and respond. So here's how the stem cells work. Where they get these from is these ones specifically come from human umbilical cord blood. Now, a lot of people get concerned about that, and like, well, it's coming from somebody else, and it's coming from blood, and there may be some issues going on with that. The thing about stem cells is that they are different than other cells. So normally when you add a tissue in or blood or something else like that from a foreign source, like a different person or something else, your body's going to have an immune response. A lot of times your body may reject it or not accept it unless it's the same. The blood type is the same, the tissue's been tested, you know, maybe it's a familial thing, it's someone in your family where like you have the same type of kidney, so it works. Stem cells don't work that way. Because they are blank, undifferentiated type cells, pretty much anybody can use them. And so you can take them from one person, put them in another, and it doesn't really cause any issues. And these go through multiple screening processes that are tested multiple times for any type of contaminant, any type of issue. Therefore, the risk for any adverse effects or allergic reactions is very, very low, almost non-existent, which means that a lot of people can use these with very little intervention. You're more likely to have an adverse effect from taking Tylenol or from ibuprofen, right? Things like blood transfusions or other medical procedures are far different than something like this. And so the way that it works is they actually take them from healthy, consenting C-section babies. So they're not just sneaking this in the hospital when nobody's looking, right? These are moms, parents that consented to this, that already knew they were getting a C-section, that have a healthy baby and have a healthy life and everything else until they consented to this. And basically what they do is when they clamp the cord, they take the blood from the cord itself because it's full of these types of cells. And then they take these cells and they go through and they test them and they go through the American Association of Tissue Banks, so all the things they would normally test in our blood and tissues for donation. And then they process and test them again to make sure they're viable, to make sure they have what they're supposed to have in there, and again, to make sure that they're clean, that there's no contaminants, no issues, that they're ready to go. And once they get all that and they have a great sample, they actually cryo-freeze it. So when you cryo-freeze it, it basically freezes something in time, so that way it can be used at a later time. So they're not going bad. So when we get them, they actually come cryo-frozen, and we thaw them out here prior to your actual injection. So that way you're getting them at their best. Because if you let them go a few days on their own, they're actually going to die off, because it is basically healthy living tissue. So by doing the cryo process, you're maintaining that integrity of the cells and all the good things that are going on inside there. So the biggest question people have, well, is this safe, right? Is there a risk of something happening or something coming up? And these are just some of the things that they're looking for that could be common in blood. HIV, hepatitis, any type of viral infections, syphilis, different types of diseases that would show up in there, any type of toxicity, any type of fungal infections, anything at all that would exist in your blood. They're screening and testing for all this. And if there's any of that at all, or any traces of that, or in the family history of the people that they're working with, they don't use it as a sample. So these are FDA approved for the stem cells, so that then themselves are screened and tested through a process. The actual administering of the stem cells in treatment is typically not, that's why it's not covered by insurance, but the actual stem cell themselves is FDA tested and approved. We have to have that to be able to use it. So you know that it's getting the highest level of standards when it comes to the quality and it comes to the safety. So here's some of the other things that's in there. So each one of the little treatment areas has the stem cells, which is going to really help with the regeneration, and this is the most important part. But you also have cytokines. We talked about this a little bit. Cytokines are signaling chemicals that are in your body that stimulates a certain types of response. Sometimes these can stimulate negative things like inflammation or downregulation, but in the way that we're using it, it actually stimulates the opposite. Anti-inflammation, healing, stimulates an immune response, so a lot of good things start to happen. And you want that because with that stimulation, you're actually triggering these to start working. There's also growth factors. So growth factors are part of what stimulates repair. Things like hyaluronic acid is what makes up connective tissue. Proteins. The proteins are the building blocks of all cells in your body. You have to have certain types of proteins to be able to function properly. And electrolytes. So electrolytes are basically hydrating your cells so they're starting to work better. So the cells that are currently there are going to start functioning better because we're hydrating them, we're bringing in proteins, we're building in nutrients and growth factors, right? It's going to decrease the amount of inflammation that's already going on. Typically in a degenerated joint or tissue, your body's constantly signaling the immune response, which is why it's sore all the time and it's painful. And inflammation is going to further break down tissues. So as we start to downregulate the inflammatory process, bring in new fresh cells that stimulate healing and repair, that's how joints can start to regenerate. Does that make sense? And that's what we really want to focus on, is stopping the degenerative breakdown process and starting to build up the regenerative type of process. And the cool thing about stem cells is it starts working immediately and you're going to get the most effect within the first 6 months. Right? So it continues to happen long beyond just the treatment itself. It's not that one thing and that's it, like maybe a steroid injection or an epidural or a nerve block or something like that. It actually continues to go for quite a while. And you can actually do these more than one time if you need to. Sometimes people have severely degenerated joints and tissues and they may need multiple treatments. There's nothing that says, oh, you can't do it multiple times. Like other things, a few different types of injections too many times, it actually causes more degeneration and it weakens your body and can have a lot of adverse effects. We don't see that because this is more natural and it actually has a stimulating health type of benefit in your body. So how this works is whatever joint or tissue that we're working on, there is a direct injection. The injection is of the serum of the things that we just talked about. The stem cells, the cytokines, the healing factors, that all goes directly into the joint or area. The reason why we want to do this is because that's what's going to stimulate the area itself to start to rebuild. And whatever tissues are in those areas is typically what the stem cells will start to become and what they'll start to stimulate. And we talked about some of the advantages with the anti-inflammatory effects. Some people notice, even right after they get it, they get some of those anti-inflammatory benefits. and they can start moving and functioning better already. We did this about a month ago with a group of patients. I know some of our patients that did it. One lady, she couldn't even stand on her knee or walk. Within a week, she was walking again and going back to doing all the things that she wanted to do. This is after months of just debilitating knee pain, and within just a week is walking and doing activities again. That's pretty amazing, right? And that's some of the stuff that we are seeing. I know personally I had it done for myself in both of my shoulders. I injured my right shoulder as an athlete in high school, so it was over 20 years ago, and it's never really worked right. And in the last month, it's better than it's ever been. And my left shoulder I hurt recently, so there's instability, but as far as the pain that I was experiencing all the time is much, much better. So it's pretty cool to see how things are changing, even with long-term issues or things that may have been going on 6 months, a year. So depending on where you are, we can look at an idea of how that works. And this type of therapy, like we talked about, is more beneficial than what you would get with bone marrow, or sometimes people will do different types of things where they oxygenate their blood, or they'll do oxygen type therapy, or thermography, or laser therapy. These things can all help regenerate tissues as well and have a stimulating healing effect, but nothing to the degree of what we're doing here. This is the most powerful way to be able to do this. And most people can do it, which is the cool part. You don't have to specifically qualify. We just look for a few things to make sure that there's no contraindications. For most people, that would be an active cancer or some kind of major disease process that just is overwhelming your body's ability to heal. And some people, their joints are just so far degenerated and gone that there's nothing left to regenerate. So many times those people may not be able to be helped, but that's why we do a pre-screening first. And that would be the evaluation we do after today, because that kind of gives us an idea to look and see what's going on. We can do a physical exam, we can do x-rays, we can see what's going on, get an idea of health history, better understand how this would work for you. So these are some of the things that are commonly treated with this type of therapy. Chronic joint pain, this is probably the most common that really makes the biggest difference. Someone who's had a shoulder problem for years that just hasn't gotten better. Someone who has a chronic knee problem, elbow, hands, feet. We're not currently doing hips because it requires some additional things with ultrasound and stuff like that, but we are working in these other joints. So feet, hands, elbows, shoulders, knees. The most commonly injured joints, because they're the most freely and most used joints, are the ones we're primarily working with. So this could be if you have arthritis and tissue's been damaged from long-term injuries. This could be more acute inflammatory issues like a tendinitis, a fibrosis, a bursitis, something like that where the tissues are constantly inflamed and likely broken down. Any of these things would be a great candidate for a therapy like this, especially if you've already tried many things. I know most of you are patients here, and that's all of you. And we've worked on a lot of these things, and for many people these things resolve. Sometimes you hit what's called limitations of matter. A limitation of matter is when we've done everything we can to help your body heal itself, but it still doesn't have quite the materials or ability because it's been too far damaged or it's been too long. This is an way to break through that barrier where all the healthy things you're doing will have an even greater effect. And that's why I'm so excited about it, is because it is frustrating when you kind of hit a plateau with an area. It's gotten as good as it can get right now. This is an opportunity to make it even better. And we'll answer some questions in just a couple of minutes. Yeah. So really, when we look at these different options, there's a few different things that you can do. And you always have choices about how you take care of them. Like we said at the beginning, I just want to present this as an option that you may be able to look at if you are still struggling with the joint issue and you want to get things improved, you want to do it in a more natural way. This is a great way to be able to do that. For many people, the other options of what they do is they either just deal with the pain, right, on a regular basis, which is no fun. Nobody likes to be able to do that. Or they just limit their activities and stop doing the stuff that they want to do. So they just, I can't go for walks anymore, or I can't, go travel or go upstairs, so I'm just not going to do it. And that's not fun either, right? We want to get back to doing the things that we enjoy. We only have a limited time here. Let's make it the best that we possibly can versus shutting down all the areas of our life that we enjoy and like to do. For some people, they're doing NSAIDs, so Tylenol, anti-inflammatory, stuff like that. And we all know those can have lots of dangers in many different ways to your health. Some people will get injections of the joints, so like epidurals or steroid injections. And the way that those work, they're a little bit different. They use specific types of chemicals which can deaden and decrease the inflammatory response, but they're not always effective. I work with orthopedic doctors, and they'll tell you a lot of times, if they're being honest, you have like a 1 in 3 chance of it working for you for a temporary pain relief. Some people notice no change, some people notice that it's a little bit worse. But we know every time at best you're getting a temporary response because it's not fixing anything, it's not regenerating anything, it's just deadening the area for long enough to where it feels better. And for some people it helps them do the rehab and stuff necessary as a result of that, but most people end up having to do it again. But the bigger problem is that it actually degenerates your joints further. So instead of regenerating, it's degenerating joints faster, which typically is why there's a limit to those. And those can cost, $1,500. I've seen them $3,000, $4,000 or more for those types of injections. And then the other thing, which we all would like to avoid, is surgery, right? Because surgery is no fun. Surgery, there's always risk and danger. Even if it's a simple, non-invasive surgery, there's always risk of infection. There's always rehab that happens. It's definitely the most costly type of procedure that you could do. Even if it's covered by insurance, typically you have a co-insurance or a copay, which is usually in the thousands of dollars, right? And you're going to have a recovery period. You're going to have a downtime period of pretty extensively where you're not able to do things. So there is cost in many different ways, multiple follow-up visits, physical therapy, you got to make appointments. And now, who wants to go to the doctor now? The way that it is, that's no fun. Actually, a lot of people this year who their surgeries or other things were canceled, right? And that's the reason why they upped all their stuff. Like a lot of elective things they were going to have, they're just not even doing it right now because they're so focused on these other things. So maybe that's where you are, right? And you want to look at this instead of doing something like a surgery. Versus the stem cell injection is about a 30-minute appointment. You can come in and do it and leave the same day and go back to doing your stuff, right? There is a period of time where you want to allow your body to heal. So, you don't want to get it done and then go run a marathon on the knee you just injected. Like, that's not a very good idea. But you can go back to your daily life. You can walk out that day. You can go to work. You can do your basic stuff, right? There's some certain things that we ask you to do to get the most out of it. But by the most part, you should be able to do that. And sometimes we need a follow-up visit. Sometimes we don't. Right? Most people are just doing well and they just start going about their life as they move on. Very limited downtime. I know I did have soreness for the first day or two, but then after that it started going away. So it's the equivalent of a soreness of if you worked out really hard and your joint or muscles are sore is basically what it felt like. It's pretty temporary and then you're able to start going back to doing the things that you want to do. So that's really why we look at the different options and how that goes. Right? Again, the decision comes up to you. But I find a lot of people want a more non-invasive, more natural, healthier type of thing, and that's what we do here. The only thing is, for some of those people that have insurance, like, well, my insurance covers when I get these things, and my insurance would cover this, it doesn't cover this type of procedure. You can use HSA or flex spending or medical spending that you have available sometimes through insurance. Those can be used because that has a broad spectrum of what you can use, but your Kaiser plan's not going to cover it. Medicare is not going to cover it. It's not a service that would fall right within there, just so everybody knows that. And it's an idea of cost. It can vary based on how many joints we're doing, what parts of your body that we're using, how much we're doing. But the average cost ranges from about $2,500 to $5,000 if we're doing 1 or 2 joints or multiple areas. And there's different ways to be able to pay that, and we've been able to use payment plans and stuff. So it still is an affordable treatment. It's not 20 grand or 50 grand. You don't have to go to Mexico to do it and all these other things. You can do it right here. We actually do it here in the office in the same day and make it really easy. So that way you just have an idea of what that could potentially look like. So there's no surprises there. And there's all kinds of research being done in this area. And I encourage all of you to research this as well. And it's not being done just for joints. As you can see, it's being done for all kinds of stuff. They're looking at using this for different types of healing therapies, immune problems. People use it for anti-aging. I have a really good friend who's really into the anti-aging, and a big part of that is stem cells. He says the biggest problem we face is actually aging because we're all going to age and die. So if we can find ways to slow down the aging process and extend that, that'd be pretty cool. And I was like, well, that makes a lot of sense. And to some degree, that's exactly what we're doing, is we're slowing down that aging process and starting to reverse and regenerate. That's pretty cool. So there's thousands and thousands of articles on these things, over 5,300 clinical trials. You can go to clinicaltrials.gov or pubmed.gov and kind of search for these things. Search for mesenchymal stem cells, search for stem cell and regenerative therapy, and you can start to learn more about how this process works. Do the stuff for yourself, right? We're here to answer questions for you. We have a medical team behind us that can answer questions that have been doing this for years and have lots of experience and really understand the science and everything else that goes with it as well. So now I do want to open it up for some questions so you guys can understand more about what's going on. These are some of the consistent questions that people do have that we answered a lot of these. Is it safe? I think we went through that pretty well. It is definitely safe, well tested, and well administered. Most people only need one treatment, but you can get multiple. The downtime is very little. Many people can go back to doing their same stuff the same day. Like we talked about lasting, that can last up to 6 months, sometimes more. Some people notice effects right away, like immediately after the injection. Some people it takes a week. Some people it takes a couple of weeks, a month or two. It really depends how bad it is, how healthy you already are, what your lifestyle looks like. It can differ. If you need additional treatments, we can discuss that individually, but I would wait at least that full 3 to 6 month plus period just to make sure you're getting the full benefit first. And if your doctor hasn't talked to you about it, that's not a real big surprise. That's not really on their list, right, of the stuff that they do. It's not something that's available to them. Drugs and surgery is pretty much what they do best. So that's more likely what you talked about. If you go to somebody who's more natural, like a naturopath or something like that, they may have talked to you about something like this as an option, but it's still kind of newer for a common use, which is maybe you might not have seen it. And if you want to know if it's right for you or not, the best way to do it is to schedule a follow-up so we can do an exam and go through a consult, look at your health history and stuff like that. We only charge $50 for it. It's really easy. It's about a 15-minute appointment. That way we can see how this is going to go. We can evaluate the joints further. We can go through any medical history, answer any questions on a more individual basis.